Hi, this is Tim from the Sim Lab here, and we're going to do just a brief tutorial for you today on how to set up just a maintenance IV infusion of a crystalloid like normal saline or lactated ringers. And we're going to walk you through being able to prime your tubing and to be able to set up the pump for just a basic maintenance infusion. Then we're going to also talk about setting up a secondary set with something like an antibiotic. And what we'd like for you to do is to be able to be competent when you come in for your simulations. So it's important as we continue to advance these videos and get them out to you that you watch them before you do your simulations. So very briefly, let's talk about, let's say you get an order for a lactated ringers, and the order is going to be lactated ringers at 125 cc's an hour, and that this infusion is expected to be continued throughout those patient's hospital stay. So naturally we're going to get a 1,000 cc bag. And then it's important that we pick up and that we choose the right tubing. And for this one, it's a Baxter Continue Flow Solution set with a dual vent spike, and it's a 10-drop set. I know that in your math that you've just taken, that a standard drip set is described as a 15-drop set, but you're going to see a lot of 10-drop sets with this Baxter tubing. So we want to make sure that we don't confuse that with our secondary tubing that we're going to be using here shortly, that is also a 10-drop set, but it's also much shorter and it has the plastic hanger with it. So we're getting the longer tubing, even though it's in a similar package, and then we're going to open that up and we're going to spike our IV bag and get it ready. And just a reminder, in the sim lab, we always spike our IV bags upside down because we use these bags over and over, and the little diaphragms are worn out on them. And if we spike it this way, you're going to get a bath with this and possibly get fluid all over our pump. So be sure that we do this upside down, just a reminder. And then you're firmly spiking your fluid. And at this point, you can turn it upside down and you can prime it. Into a sink, receptacle, somewhere, or a trash can. Just being careful not to get the bottom of your tubing into a soiled area. But we're going to prime our tubing all the way down and purge it of all the air. Okay, that should do it. Now we're going to hang this up here for now, and then we're going to talk about our pump. Now, these pumps are fairly easy to use. We're basically just going to power it on. And once it powers up, it's going to default to a list of care areas that we're going to choose. Now there's multiple care areas on it. Today we're just going to pick the med-surg area. There's other areas you could pick such as ICU or pediatrics, etc. And we're going to hit OK. And so you hit OK each time you choose something on your menu there. It's kind of like hitting enter on a computer. And then we're going to type in the solution that we want to put in. And when you do IV fluids on these pumps, it's very simple. We're simply going to put in IV, and you use this like an old analog telephone, and you key in I and V. And it gives us a list of IV fluids, and it's somewhat of a generic list where it just says IV fluids 1,000 milliliters, and it gives you a choice of a 500 milliliter bag. Then it has choices of IV fluids that have additives. We're not going to go into all of that, but when we're choosing just like a crystalloid solution, such as normal saline or lactated ringers, we're going to pick just IV fluids, and we're going to pick the 1,000 milliliter bag and hit OK. It's asking, is it the primary bag? And the answer is yes, this is our primary infusion. So we're going to hit OK on that. Now the rate per hour that we discussed was 125 cc's an hour. So it's giving us the opportunity to key that in, so it's 125. And once again, we have to hit OK with each entry so that it will advance. If you don't hit OK, you'll find that your pump won't advance and you won't be able to get it set up, so OK each time. The volume to be infused is 1,000, hitting OK again. And then it goes to and it says volume given. You don't have to enter anything there because that's just going to count down with each milliliter that you give as you're infusing. Now it's asking me to load the pump. And this is also very simple. We could have actually loaded the pump before we programmed it, so you can do that in any order. But to load it, you use the slide clamp here as like a little key, and you insert it into the top of the pump. And you simply push down. Then you load your tubing. And there's a little indicator there, a little check mark that tells me when my tubing is loaded. Each time you have to press each channel there. Then you close the door and you pull up on the clamp. And as you pull up, it comes out of the slot and it also unclamps the tubing. Now it's asking another question. It's asking, do I want to deliver a loading dose from the primary bag? Well, the answer to that is just about always no, because we're not asking you to give a bolus here. We're simply wanting to start an infusion. If we're going to give a bolus, that's another a topic for another day that we're going to do a separate video on. So we're going to answer no with this. And at this point, we should be able to, once we've attached our IV tubing to our patient's access, we should be able to hit run.